The Affordable Care Act, which is known as Obamacare, is now in place and it is a year old. Americans are still navigating what it is and what it means.
We want to start with Senator Franken. Senator Franken, President Obama said repeatedly, if you like your doctor, you can keep him or her. If you like your policy, you can keep it. PolitiFact called that the lie of the year in 2013. With all due respect, have you been lying to the people of Minnesota?
I have not. I didn't say those things. The president, I think, was engaged in some wishful thinking, but let's talk about what the Affordable Care Act has done in Minnesota. We've reduced by 40% the number of uninsured. 95% of Minnesotans are now insured, second most in the country. There are some problems. Those are two problems in the rollout. But let's make this clear. Mr. McFadden wants to repeal the Affordable Care Act. That he's run on that the whole time. I want to just repeal it. I want to repeal it. We have to fix the things that are wrong with it, but build on the things that are right. If you repealed it, we would go back to square one, and you wouldn't have people with pre-existing conditions being able to get coverage without paying a penalty. Women would again have to pay more for their health care just because they're a woman, for their insurance. People who have gone through their lifetime cap or annual cap would be thrown off their health care again. Kate Day, a mom whose daughter Evelyn has cystic fibrosis, says her daughter's alive because they got rid of these caps. You look at all the...
Let's ask him. Let's ask Mr. McFadden about that. You've made this a big part of your campaign. Repeal and replace, you say, but you say, Senator Franken doesn't agree, you say you want to keep pre-existing conditions. You want to keep 26-year-olds on their parents' policies. You want to keep the lifetime, no lifetime limits.
Yep.
But you also say no mandate, no individual mandate. It doesn't seem to work. All of the health experts say that's Obamacare, but for the mandates.
Well, Pat, we have a health care issue in this country. I mean, I know that as a businessman. We've had it for a long time. But Obamacare is not the right solution. It's a train wreck, to quote Max Baucus, who's a Democratic.
Out of context, you're quoting him, but go ahead.
But first of all, I have come with a plan, and I want to talk to that. But before I do that, you started about the lie, which Politico called the biggest lie of the year, that if you like your plan, you can keep it. If you like your doctor, you can keep it. We know that not to be true. But the biggest lie of all was when the president and Al Franken said that this would make health care less expensive. That's not true. It's absolutely not true. And I know that because I'm out talking to people day in and day out. Pat, when we know that with Preferred One, which was the low-cost provider on MNsure last year, they've just come out with their new rates. They're going up 63%. It's huge rates. When I was in Rochester last week, a woman came up to me who works at Mayo Clinic, which is the largest private employer in the state. Her premiums are going up 50%. Her deductible's going up 220%. She had a look of fear and anger.
Well, that's harsh, Senator Franken, where he says that's a lie that you've been telling Minnesotans.
Well, let's
focus it on these premiums going up.
Sure.
3 weeks from tomorrow, thousands of Minnesotans are going to go to the MNsure website. The estimates are all over the map, ranging from 4%, which I think has been debunked by a lot of experts, to 11%, on up to 60%.
Their rates are going to go up.
What do you say to people who are concerned not only about the increase, but the uncertainty?
Some people have seen their rates go up. Some people have seen them go down. I talked to Lauren Nelson, who is a manufacturer in Itasca County. He employs 48 people. His went down 8.5% for his 48 employees. But let's make this clear. What he is talking about, let me make this clear. What he is talking about is repealing this, and it goes back to square one with a Congress that is where there is obstruction and where there is gridlock. So all this disappears immediately. All this guarantees disappears immediately.
Al, I will agree with you that we have a health care issue in this country. We absolutely have it. We've had it. But Obamacare is not the right solution. It is a disaster. And to say that it's going to lower costs is patently wrong. it is going to rise. It's going to raise costs. We can't afford it. And the difference between me and you, Al, is I want the states to control this. You want the federal government to control it.
But he
but
says
that's
that
been done.
if you do what you want, it all disappears.
And the rates go up. Experts have looked at your models, Mr. McFadden.
When Al Franken and I were in Duluth debating, in front of the audience in Duluth, Al Franken said that there's many problems with Obamacare. He's not come forth, though, with one solution. I've come forward with a plan to drive down costs.
But, Mr. McFadden, experts have looked at your plan and said that your plan will not keep costs low because you don't have that mandate.
No, Esme, that is wrong. And, Pat, that's wrong. What I said is the states can decide if they want to implement a mandate. But I don't want the federal government to do it. So if Minnesota wants to say we want a mandate, they can do that. If Arkansas doesn't want a mandate, they don't have to do it. I believe that the states are laboratories for experiment.
Sounds simple, Senator Franken.
NPR had experts look at his plan and said it doesn't add up. But that doesn't matter because it's not going to be his plan. There are 435 members of the House. There's 100 members of the Senate. Everyone will have a plan. Your plan doesn't get adopted because you're running for office to say you're going to have a plan adopted. What happens is this immediately goes away. Now, I have offered fixes, okay? And I have bipartisan support on something called reinsurance, which is to help businesses and unions that self-insure. Mark Kirk, a Republican of Illinois, is a co-sponsor of my legislation. To say that I've offered nothing, there's something called
that is a minute piece of this.
It's an important piece to those unions.
What Minnesotans want is straight talk. And Obamacare is not working. It is not working. There's a better way forward, and I believe the states are laboratories for experiment, and that this should be implemented at a state level.
And I'm sorry, gentlemen. I'm sorry that is all the time we have on this.
I just want to talk about costs in Medicare.
Okay,
it has seconds or less.
Okay. They are $1,000 a year less per beneficiary in 2014 than were predicted in 2009. That we have, because of the kind of care that we've incentivized health care as opposed to sick care, and doing the kinds of things that we do in Minnesota, and we're number one in Minnesota for a reason.
We only have 10 seconds, and I'm like, Medicare Advantage you want to do away with, and
that is completely not true. There are more.
Gentlemen, I think we could probably do
Americans. There are more Americans on Medicare Advantage now than ever before.
Gentlemen, I think we could probably. Gentlemen, I'm sorry because we want to get to a lot of topics. I think we could probably do an hour on this alone.
Minnesotans want
Hang on just a second, sir.
To say that this is going to lower the cost of health care is an outright mistruth.
Okay.
Everyone that's going to their mailbox and getting their premiums for next year are seeing staggering rises across the board.
Gentlemen, we're going to have to take a break.